Here on the Colour of Country Life Flow FM, we're speaking with one of our regulars, the member for Frome, Penny Pratt. But Penny, you're a long way from your electorate down in the southeast. Why is that?
Well, good morning, Ricky. Happy New Year. Receiving you loud and clear from Mount Gambier and the Limestone Coast. I'm travelling down here with all of my Liberal parliamentary colleagues. And we've been here a number of times in the last 12 months, but of course I get around most of regional South Australia when I can.
And you're part of the shadow cabinet with regional health services and other responsibilities. But just before we get into some of your new responsibilities received over the new year, what are you hearing from the locals there, particularly on the health front?
Well, the residents of Mount Gambier are very receptive to the fact that the Liberal opposition continue to front up to listen. And in my portfolio of regional health, there's nothing more critical or more pressing or front of mind than access to GPs. I'm parked out the front of Sarah's Medical Clinic, and access to GPs is essential for young people and old. Now, we know that that's a national challenge, but in regional South Australia, where we're seeing a shortage of country GPs, people want to know what the solutions are. And this is a challenge that I will continue to put in front of Minister Chris Picton and Federal Minister Mark Butler.
And we spoke with your colleague, the Health Shadow Minister, Ashton Hearn, who's with you down there recently. We talked about elective surgery wait times. Is that also a problem for people down in the southeast, the time it takes to get to see a specialist or get surgery? There's
certainly pressure on every element of the health system, and I know that some people who require surgery are being diverted to smaller towns outside of Mount Gambier like Narracourt. So it's certainly been raised, and they're conversations that I'm having with orthopaedic surgeons and cardiologists who are connected to this region. Mount Gambier is our second largest population in the state, and it is fitting that we see funding and investment allocated to the population of the Limestone Coast. Of course, Ricky, I put my hat on for all of regional South Australia, and I want to see the funding, that share of the pie, being spread from the west coast to the far north and all points in between. I think that the real critical element is creating this pathway or pipeline of university graduates studying medicine to see country GP practice as a really appealing lifestyle choice. And there are a lot of passionate people in Mount Gambier with suggestions and solutions on how we can work together to develop policy that delivers that.
Now, the Health Minister, Chris Picton, spoke with us after Ashton Hearn's interview about the ramping situation. He said, among other things, this is the ramping situation in Adelaide, but talked about how they were using capacity in regional hospitals to help with the strain on metropolitan hospitals. Are you hearing that that's having any impact on the regional health services themselves?
If I was a country, if I was a listener this morning, reflecting on the hospital in my local town, I'd be really concerned to hear the state minister saying that the capacity is beyond what our big metro hospitals can carry, and that there's an overflow to regional hospitals. We are already suffering from limited resources. So it's concerning if the minister, is demonstrating that the city system isn't coping. We know that the Labor Party went to the government promising to fix ramping, and instead what they've delivered is an increase in record measures. So I use the voice that I have with this portfolio to push back to the minister that his focus needs to, in fixing the health system, needs to go beyond the city metro system, and to ensure that we are stabilising and resourcing health services in regional South Australia, so that when it comes to, for example, the doubling of the PATS scheme, which I really welcome, Patient Assistance Transport Scheme, that the minister's answer when I begged him to match our Liberal promise to do that was really to say, look, the Labor government intends to invest in regional centres so that people don't have to travel. Well, we're not seeing a return on that investment for many years to come. So I certainly would say there's a lot more that needs to be done.
Yeah, you mentioned the release of the doubling of the PATS scheme. The opposition had pledged to do that going into the state election. It was something we were asking Chris Picton's office about. Sam Telfer, your colleague over on the West Coast, he'd also been advocating on this. But it does sound like, it just seemed odd to me that this dropped I think it was on New Year's Eve or New Year's Day, almost a dead news day that the government put this one out. It's almost like they didn't want to be associated with it.
Well, Ricky, my view is that on a sleepy summer's day, the 2nd of January, where the policy was effective immediately from the day before. So from the 1st of January, regional South Australians who have critical health issues that require them to travel more than 100 kilometres one way can access a reimbursement. That subsidy was 16 cents to the kilometre, and it's been doubled to 32. Now, that will sound like small change for many people, but it becomes hundreds of dollars. It's a significant announcement, and it is a substantial investment. And to use a city paper to drop a message to country people, 13,000 people used that service last year, I think reflects a city-centric government.
Well, we also need to focus on the topic of mental health and suicide prevention. This is a couple of your new portfolio roles. What have you taken hold of since taking on this role?
Ricky, I'm really fortunate to be a shadow minister at all, and the leader, David Spears, allocated to me last year, as some of your listeners might know, the Regional Health Services portfolio along with ageing and preventative health. Over summer, I have also been afforded the privilege of becoming the Shadow Minister for Mental Health and Suicide Prevention. And with a background in teaching primary school wellbeing and, a real passion for staff welfare and neuroscience, I'm extraordinarily privileged to be able to spend time meeting with stakeholders who are experts in their field. Of course, when I reflect on the farming community that I represent, it isn't always a happy space. This is a service that I want to see expanded to ensure that people who live in regional South Australia requiring mental health support suitable for them can find it where they need it, when they need it.
Yeah, absolutely. We see these trees painted blue in paddocks sort of as a reminder that mental health is ever present. And could it actually be masked amongst some pretty good harvest conditions in the last couple of years that some people are still struggling out on the land?
Look, you're referencing a Blue Tree program, which I think is a visual cue and a soft way to remind people about the stark, tragic element of people who can't manage the suffering that they're experiencing and take their own life. And it's a big topic for your listeners, and I certainly would encourage people to look after themselves if this conversation is upsetting. But we don't want our regional community members to be suffering without knowing that there is support available. And there's a lot of fantastic work to do to ensure that across the state I'm tapping into the 50 suicide prevention networks. Of course, in my town of Clare, we have one called Trailblazers. Over on the Eyre Peninsula, we've got mentally fit services. All around the state, people in their own community are taking up the fight against the black dog, and I think really showing that pastoral care and compassion for those in their community. As you say, we've experienced a bumper harvest, $4 billion through summer, and it was a bit of a rush to get the crop off. But those heady amounts can mask actually what might be in reality a massive overdraft on the farm or debt that needs to be paid off. So good times doesn't necessarily mean there's no anxiety or depression. And as I said, I've got a privileged position now to become the spokesperson for the Liberal Party on the essential need for more investment in mental health services so that our communities can be strong and prosper.
Yeah, Penny Pratt, the member for Frome and Shadow Minister for a range of regional and other health portfolios. Important points you make. You did mention, reaching out for help if you need it. Lifeline is there 24 hours a day, 7 days a week, 13 11 14, and Beyond Blue 1300 22 46 36. Thanks for joining us today, Penny. We'll catch you soon.
Thank you, Ricky.